Hi everyone, welcome back to my anal conditions series. My name's Kathryn, I'm a colorectal surgeon, and this is my series called Kathryn in the Cabin, set in McCarthy Clinic HQ. I've got lots of informative little videos about the type of anal conditions that I treat in my clinic. I've tried to come up with some topics that are of great importance and are commonly experienced by the patients that I see. And I thought today deserves the attention of the condition called anal spasm. In the colorectal community, we call this anismus. It is very similar to a condition seen in gynecology patients called vaginismus, and essentially is an increased resting pressure in the anal sphincter muscle fibers. And today I'm going to be taking you through a whistle-stop tour of the 4 important things to know about anal sphincter spasm. The first thing to say is that we're not born with an anal sphincter that is in spasm. There are some congenital abnormalities that some babies can experience to do with the anal sphincter that are in a separate category to this. And so the pressures within our anal sphincter muscles are something that can be increased with time. Now, there are 2 ways that the pressure can increase. The second point is that the increased resting pressure may be something that's to do with your technique. It could be that you are rushing the defecation process, you are straining because you simply don't have time to open your bowels. You may then get a painful anal condition such as an anal fissure or hemorrhoids, what we know to be piles. And this can lead to spasm in the anal sphincter because these are very painful anal conditions. The third point to say is that I have also seen patients who have an increased resting pressure in their anal sphincter muscle and also more globally in the pelvic floor muscle. The pelvic floor muscle is like an upturned bowl. It has a very important function that it maintains the correct position of the pelvic organs such as the bladder, the rectum, the vagina, the cervix, the uterus, and the bowel loops that are within the abdominal cavity. If the entire bowl seizes up, then it can also cause the same symptoms of patients who have a seized up anal sphincter as a result of painful anal conditions. So what causes that entire bowl to seize up? Well, I have seen it associated with stress-related conditions and anxiety. Stress is very harmful for the body, and we can carry stress in our body in relation to the amount of cortisol in our circulation. And that can manifest in a number of different ways. We can tense the jaw and get painful jaw. We can get tension headaches, and we can seize up our sort of butt cheeks as a knee-jerk response to intrusive thoughts or stressful things that happen throughout the day. The downside to that entire bowl of muscle seizing up is then it's very difficult when you need to use that muscle to have day-to-day functions such as passing urine, having sexual intercourse, or opening your bowels. And it is unfortunately a vicious cycle, as once it's seized up and we don't identify the root cause, every time we go to use the pelvis, the pain gets worse and the muscles can seize up more. So that leads me on to the 4th point. How do we relax that entire sphincter pelvic floor muscle component complex? It can be very difficult to identify what the problem is. We can assume from things like fissures and hemorrhoids that you will have a seized up anal sphincter complex. Those related to stress and anxiety are much harder to pinpoint. It's harder for patients to accept that they have this physical problem as a result of what's going on day to day that may have become ingrained. So I've done a video specifically on how to open your bowels and how to care for the anus. It is an art form, and really I would advise you after this to then look at that video to see where you can make some improvements in the defecation process. But if you want to identify those muscles and work out how to relax them, then it can be very difficult and you will need help with this. A daily sitz bath is definitely recommended to improve pelvic health and relax the pelvic floor. Going to see a pelvic floor physiotherapist usually are very beneficial in helping you getting back on track to identifying which muscles have seized up. But don't take the pelvis in isolation, look at the entire body. What do you do every day to deeply relax? Well, some patients say to me, well, I go for a run. I go to the gym and I lift weights. Now that's great for mental health, but it's not relaxing to the pelvic floor. Lifting weights above the shoulder and going for a run has a huge pounding repetitive effect on the pelvic floor that causes it to tense up more. So these activities, whilst they may be helpful for you in terms of your de-stressing, are not particularly helpful for your pelvic floor. So then it comes down to whatever floats your boat, really. And I would urge you to try a variety of different things to see what you can realistically incorporate into your life, because you would need to do this daily. Simple things like guided deep breathing exercises are really good for stimulating the vagus nerve. Now, the vagus nerve is a relaxation nerve, and if it's not working effectively, your guts simply won't work effectively and you won't absorb the nutrients from the diet that you're eating. So you may be eating a really high fibre diet and a whole 30 different coloured plants a week, but it won't be absorbed properly if your vagus nerve is not fully relaxed. So 10 minutes at least deep breathing exercises a day will go a long way to helping. And if you can build on that, things like going for a massage, Reiki, reflexology, tree bathing, going to walk in a forest regularly, weekly, to inhale the aromatic compounds, to try and deeply relax the body, all of these things can be beneficial, and I would urge you to see what works for you. So that's the tip for today, and don't forget to watch the video on how to open your bowels effectively.